All right, Michael, we can go ahead and get started.
Welcome, everyone. Good afternoon, and thank you all for joining us. The Dialogue is very pleased and proud to release an Inter-American Health Force white paper, Deepening Cooperation and Coordination on Health Policy in the Americas, a new approach to health emergencies. The idea for this initiative emerged last year in the context of the enormous shock of the COVID-19 pandemic, the extent to which it ravaged nearly all countries in the Americas, and also the extent to which, unlike previous health and other emergencies, each country turned inward. There was a notable failure to take advantage of opportunities to work together for cooperation to address a variety of challenges. This is certainly understandable, but at the same time, unfortunate. Coordinating efforts would have been effective in devising best practices, sharing relevant data, harmonizing policies, and other key functions in responding to the emergency. Dialogue wanted to adopt a regional inter-American perspective, recognizing, of course, that the pandemic is a global emergency. But there are certain particular features of this hemisphere, past experiences and institutional arrangements that were important to examine and try to take advantage of in pursuing a constructive path forward. In the spirit and the approach of the Inter-American Dialogue, we also wanted to create a task force of influential leaders from diverse backgrounds and perspectives, from the private and public sectors, as well as politics, academia, and civil society, to share their valuable experiences and expertise with a commitment to produce the best product possible. Our purpose was to analyze and identify actionable recommendations to improve cooperation and coordination in health policies in the Western Hemisphere. The recommendations apply to the current continuing crisis of COVID-19, but also to future health emergencies that the world and this hemisphere will inevitably have to confront and deal with. We're confident that these recommendations will be useful for decision makers at different levels and different capacities in dealing with this and future crises. I want to take this opportunity to thank all of the members of the task force for their valuable contributions, and also to thank our outstanding co-chairs, Julio Frank and Helene Gayle, who join us today. I also want to thank Beatriz Londoño and Heidi Botero for their excellent contributions to this effort. Beatriz was the technical director of the effort, and Heidi provided support. And also at the Dialogue to Denise Yanovich for coordination of this initiative and for the assistance of Kate Blancett as well. I also want to recognize the valuable input and contribution of Ariel Fishbein, who's the director of our education program. Let me also give special thanks to those who supported this effort: the World Bank, the Inter-American Development Bank, and United Healthcare, without which it would not have been possible to carry out this important initiative. Today's format is the following. We will be hearing from our two highly distinguished co-chairs to get us started. First, Julio Frank, who's the president of the University of Miami and also a member of the Inter-American Dialogue. He is a Mexican physician and has a very, very distinguished career in academia and also public health and public policy. Then we will hear from Helene Gayle, who is the president and CEO of the Chicago Community Trust, also a member of the Inter-American Dialogue. And before assuming her current job, she was the CEO of McKinsey's Social Initiative, a nonprofit that brings together various stakeholders to address complex global social challenges. Before that, she served as president and CEO of CARE USA. Helene also has a very distinguished and impressive background. After hearing the presentations from Julio and Helene, we're very, very fortunate to have with us today two commentators to talk about the white paper. and to share their views. First, we'll hear from Felipe Jaramillo, who is from Colombia, the Vice President for Latin America and the Caribbean at the World Bank, who has shown enormous, impressive leadership at the bank, focused on reducing poverty, growth, fueling growth, and supporting equality, and also protecting the environment. Then we're delighted that we'll be hearing from Ramiro Guerrero, who is the Dean of the School of Economics and Finance at the Universidad IESA in Cali, Colombia. And Ramiro has worked as a research associate also at FEDesarrollo, which is a leading economic policy think tank in Colombia, and was also the economics editor at Semana magazine. So we're delighted to have both of them as commentators. After their commentaries, we will open it up to the audience for additional comments and, of course, any questions that you might have. Participants can submit questions using the Q&A feature in Zoom or by emailing meetings@thedialogue.org. We have simultaneous interpretation to Spanish that's available for those joining this event via Zoom. To access the interpretation, click the interpretation icon in the black bar at the bottom of your screen and choose your preferred language. So with no more introduction, it is a great honor to present first Julio Frank, who will be followed by Helene Gayle. So let me turn it over to Julio.
Thank you, Michael. Thank you very much. And thank you all for being here. I am truly delighted to join you for the culmination of our work on our white paper, the title of which is Deepening Cooperation and Coordination on Health Policy in the Americas. This is a watershed moment in human history. As the world begins the gradual and slow and complex and convoluted process of emerging from a pandemic, the magnitude of which the world has not seen in a century. The pandemic, which produced or exacerbated crises on the health, economic, and social fronts, has accelerated trends that were already present beforehand. Our region, Latin America and the Caribbean, which is home to only 8% of the world's population, has seen nearly 1/3 of COVID-19 deaths worldwide. Even though we are not yet out of the pandemic, with variants, barriers to healthcare access, lack of coordination, lack of access to vaccines where there are no vaccines, and vaccine hesitancy where there are vaccines, all those factors are delaying our emerging from the pandemic. Even though we're still very much in it, we must apply the lessons learned to begin building not just a new normal, but a better normal. Now, let me turn to the heart of the work we have been doing. The purpose of this white paper is to understand the lessons and challenges of the regional response to COVID-19 and appraise in retrospect how they were addressed and how they could have been addressed. But the paper also makes prospective recommendations in 5 specific areas geared towards improving cooperation and coordination in health policy to support regional COVID-19 response and recovery now, but also, and very importantly, future health emergencies. Those 5 areas are, first, promoting leadership and better governance in regional health emergencies. 2, increasing access and sharing of high-quality data. 3, strengthening regional health security by investing in national preparedness. 4, ensuring equitable access to COVID-19 health services and products, in particular vaccines. And 5th, controlling and managing the spread of misinformation, disinformation, and conspiracy theories. I will introduce our recommendations on the first 2 areas, and then my very esteemed co-chair, Helene Gayle, will outline recommendations on the other 3 before opening up for the initial comments from our very distinguished members who are commenting, and then for an open discussion. Now, one instrument that structures our recommendation is a matrix that begins on page 35 of the report, for those of you who have it. And there we examine the challenges and lessons before us on those 5 areas, but we examine those through the lens of 6 stakeholder groups: governments, multilateral organizations, international financial institutions, the private sector, scientific and academic institutions, and then also civil society organizations. So the idea was to make these recommendations actionable for all of these specific audiences. Each one of those groups has played and will continue to play an essential role in overcoming the pandemic and preventing and addressing future health emergencies. Now let's move then into the first topic, the first of the 5, leadership and governance. While the pandemic is clearly a global process, a strong global response requires strong national responses. These are not 2 different levels, as one might infer from the language we often use. Sometimes we talk about the global and the local as if they were different levels. No, they are connected. We truly need a global approach that blends a focus on everything that's happening around the world and how that gets translated into local realities and vice versa. And therefore, national leadership is absolutely essential in an emergency. The striking feature about this pandemic, or one of the most striking features, is the huge variance in the effectiveness on national responses to COVID-19 among countries with the same level of development, more or less the same level of investment in health services, facing the exact same virus, affecting the same human species, and yet the variance in the effectiveness of national responses has been truly striking. And when one looks at the world as a whole, and particularly to our region, we see 2 patterns that emerge in the response to the pandemic. One pattern characterizes the worst responses. And in that, we have an over-representation of countries led by populist politicians. I am not saying that populism causes bad responses. There's not a cause and effect. But one is hard-pressed to find a government led by a populist leader that has had an effective response. And to the contrary, we see in the worst performance, the top places, countries that are currently or have been led at meaningful parts of the pandemic by populist leaders. And that's because populist governments have a tendency first to undervalue expertise, to distrust science, and then very sadly to politicize behaviors of people like wearing of face covers or getting a vaccine. Unfortunately, we do have an overrepresentation of that kind of regimes in our region at present, and that probably is a big factor in explaining the disproportionate number of cases and deaths in the Americas. Now, the second pattern is exactly the opposite. These are countries that have followed the science, that have acted promptly, that have trusted in the opinion of expertise, and that have, rather than seeking to divide people by politicizing the public health response, they have sought to unite their population in the face of a common threat. Interestingly, we see an overrepresentation here of governments led by women across the world. Again, I'm not saying it's a cause and effect relationship, but it is an interesting lesson, I think, in leadership. And I do hope one of the big lessons of the pandemic is it will put forever to rest the myth that women are not effective national leaders. We're seeing exactly the opposite. Those countries have also had, the countries with the best performance, a balanced approach, a balanced strategy when it comes to following the science, certainly investing in the life sciences, but also in understanding the economic realities and the social dimension of the pandemic. Reflecting on a year of the pandemic a few months ago, in a piece in the Financial Times, Yuval Harari, first of all, noted that humanity is not helpless in the face of this pandemic. We have actually witnessed the triumph of science in this pandemic, especially if one compares it with the pandemic of influenza a century ago. But at the same time, while we see the triumph of science, we have seen a massive failure of leadership. And the recommendations on this first topic are exactly aimed at addressing that failure and that contrast between what has been achieved scientifically, among other things, developing safe and effective vaccines in record times, and the way leadership has failed to protect populations. So that's where the recommendations are focused on, that second element. Leadership, of course, requires making data-informed decision. And this brings me to the second area that we cover in the report, the increasing the access and sharing of high-quality data. COVID has revealed challenges related to how we obtain, share, and utilize information related both to COVID-19, to the COVID-19 disease in itself, but also to the societal response, the mobility of people, the response from the business sector, the politicization of some of these responses. Lack of timely and transparent information contributed to some of the biggest challenges during the course of this pandemic, and that has included a failure in surveillance, first in surveillance to detect the initial outbreaks and reporting globally on that data. Secondly, delays in massive testing, and with a virus that has an exponential growth, any delay of weeks gets translated into thousands of cases down the line. Third, an absence of accurate and timely information to guide policy. And finally, a lack of accountability. So the conclusion of the report is that reliable data is essential for understanding the evolution of the pandemic, for forecasting the course, and for evaluation and accountability. Now, we emphasize, and one cannot emphasize enough, the need to protect privacy in the use of this data and avoid the abuse of legitimate epidemiological surveillance for authoritarian purposes. In the same piece by Harari, he actually makes the interesting observation that surveillance in a democracy requires symmetry between governments and citizens. Governments provide surveillance to protect citizens, but citizens must be surveilling what the government does to hold government to accountability. And that way, good data both provides a scientific foundation for public policy that protects health, and at the same time holds governments accountable for their actions. Our recommendations, if followed, will empower people to make the right choices and also eliminate the vacuum of information that is exactly what fuels the propagation of misinformation. This is the fifth area of recommendation, and Helene, Gayle will comment on that. But we must remember, as the former director of WHO, Rob Brundtland, used to say, that there are communicable diseases like COVID and communicable diseases like the infodemic of misinformation. Good data is the antidote, is the vaccine against misinformation. This set of recommendations on the two areas I've covered and the three that Helene will cover next are born of collaboration and highlight the importance of the convening function of the Inter-American Dialogue, which brought us together and tapped a very prestigious policymaker, Beatriz Londoño, to lead a research team with a truly multidisciplinary lens. It has been an honor to work with this group of dedicated professionals representing different countries, sectors, academia, government, private organizations. I look forward to hearing your reaction to the proposals, but before we get into the discussion, I am delighted to invite my co-chair, Helene, Gayle, to walk us through our recommendations on the other three key topics. Helene?
Great, thanks so much, Julio. And I just wanted to add my thanks and appreciation for all of the members of the task force. And I also want to just recognize, Michael, one of the only person you didn't thank was yourself. And I want to just thank Michael for your leadership of the Inter-American Dialogue for over a decade and all that you have done, and your real inspiration for this, as well as so many important commissions and studies to really look at how we can strengthen work in the region. And I'll just, add to some of the things that Julio said as before I dive into the last three recommendations. I think we have an unprecedented opportunity. As everyone has said, this is an unprecedented challenge, but it also presents, I think, an opportunity. The urgency of this moment, I hope, will be captured. And I think that's what we tried to do in our report, is to really capture both the tragedy that this has caused, but also what the opportunity is, and how many of the things that we recommend are the things that we should have been doing to strengthen health preparedness and health capacity in the region. But this provides us a opportunity to hopefully get it right this time. And, I was reminded in a piece in the Wall Street Journal this morning that looked at the clear correlation between the health impact, access to vaccines and other tools, and the economy. And it's very clear that we are more and more, that COVID has more and more driven the inequity that already existed, and that there's a very clear, almost linear connection between economic growth and this pandemic. And so, not only is this, as all of us who focus on health and public health and preparedness, not only is this an opportunity to get it right from the standpoint of what we do for health, public health and health preparedness, but also how we continue to think about strengthening economies as well. So, and bridging some of the economic inequities that have been laid bare by this pandemic. So I'm going to just briefly run through the three other topics and recommendations that we touched on. The first being strengthening regional health security by investing in national preparedness. And one of the things that we spent a fair amount of time is talking about the capacity under the international health regulations that are really were core to our discussions because the COVID-19 pandemic really underscores some of the longstanding challenges to meet the capacities that are required by the international health regulations, or IHR. As I think people know, the IHR is widely recognized as a really important and robust instrument for addressing health threats. However, its capacity and its potential has never really been achieved sufficiently. There's been clearly inadequate efforts to achieve the IHR's core capabilities, and there's not been the kind of enforcement and accountability that is needed to really lead to the kind of results. And so thinking about what are the right incentives, what are the right sanctions, how do we really look at building that capacity? In that regard, the task force proposed 5 recommendations to strengthen the IHR core capacity in the Americas regions. And the recommendations are based on looking at institutional support from the Inter-American Development Bank and the World Bank, which have been very actively involved in the IHR discussions and really helped in many ways to formulate these proposals. I'll just read them very briefly. They're in the report, but I think really touch on some of the ways in which the IHR can be strengthened, not only for this, but in the future. One, looking at really developing periodic peer network reviews for enforcement. And again, I think this whole notion of the accountability and the enforcement that is important was highlighted. Secondly, strengthening investments in health systems to help increase the public health capacity and improve public services. We all recognize that we let the public health capacity dwindle in between crises. This is an opportunity, again, to strengthen the public health capacity at a moment of critical urgency. Third was ensure health security remains among the top consideration in discussions of ministers of finance. We often relegate issues related to health, and sorry for those who are former health ministers, but think about health only in the context of health ministers. We know that it is critical that we get health and the health priorities on the agenda of our finance ministers, obviously with the technical collaboration with ministers of health and others, but critical to make sure that this that health security really gets higher on the agenda. Expanding interregional collaboration, particularly a focus on CDC and global health partnerships with a broader range of Latin America and Caribbean countries than currently, and how important that those partnerships have been in terms of strengthening public health capacity. And then finally, ensuring active participation in discussions on framework convention for pandemic preparedness and response, looking at the vehicles that are already established with member states to feed into the work at WHO, but really strengthening active participation in that framework. So those were the recommendations that we had around ways in which we could strengthen regional security and really invest in national preparedness and really strengthen that for the future. The third, the fourth area was ensuring equitable access to COVID health services and products, and in particular vaccines. We don't have to go into a lot of detail on how unequal access to vaccines has been and how nations have thought about their own national interests. There's been hoarding of vaccines, hoarding of other essential products, drug shortages, unequal access to drugs, as well as other critical life-saving health products, bad standards in terms of health products, falsification, all of these challenges that we've seen. And so in some ways, this has brought out some of our worst examples of collaboration when it comes to access to vaccines and other health products. So clearly, this was an area of vigorous discussion on how we can make this more equal, making sure that what we've seen in terms of the kind of unilateral initiatives and fragmented distribution of supplies and services, really looking at how do we look at this in a much more integrated way, in a way that looks beyond one's self-interest. So we proposed 7 recommendations on equitable access for the Americas regions. And I'll just highlight those very briefly. 1, strengthening national regulatory authorities in Latin America and the Caribbean. Clearly, the role of regulatory authorities is critical as we think about not only the access, but making sure that highest quality, highest standard of products are available. Secondly, improve regional coordination on COVAX. COVAX has been so critical, and standing up COVAX has been so critical in terms of getting access to vaccines, but countries could do much more to work together on making sure that there's enough financial resources made available to COVAX to meet its financing needs and make sure that we do have this more equitable access to vaccines. Establish national stockpiles of medical supplies. We know that many countries went into this without having the kind of stockpiles that would have prepared better for urgent needs. So most countries in the region need to work on ensuring a national repository of these potentially life-saving pharmaceuticals and medical supplies, so that for medical emergencies, there is this preparedness, there's the stockpiling, and better ability to forecast and plan for public health emergencies. 4th, incentivize and increase regional manufacturing capacity, supply, scale up, and processing for COVID vaccines and treatments. We spend a lot of time particularly talking about the role of the private sector in this regard, and how many countries in Latin America and the Caribbean have the capacity for manufacturing, and that capacity needs to be strengthened so that there isn't a reliance on only a few nations, and that there is that regional ability to produce supplies and think about equitable access. 5th, incentivize and strengthen regional procurement negotiations. Again, in the effort to have a much more integrated system of procurement where there's not unilateral, where there's not the kind of hoarding that we saw, and where there's fairer pricings, clearly governments can negotiate better prices, more reliable supplies if this procurement is done in a much more integrated and a more holistic way. 6, optimize the delivery of health services and platforms, strengthening health systems throughout the region, making sure that there's a priority on looking at essential health services and the strengthening of essential health services so that once supplies are available, the service and the service delivery platforms are available, and then accelerating the implementation of the trade facilitation agreement. Again, the agreement is in place, but really setting forward a higher priority on making sure that TFA is in place and sound. Finally, the last area, and Julio touched on this, is controlling and managing the spread of misinformation and disinformation and conspiracy theories. We know, and we've all talked about how this is the first ever global infodemic where misinformation, disinformation has fueled this pandemic, whether it's fake news, social media, rumors, stigma, all of the things that we have seen in this pandemic, which has led to behaviors that have been detrimental to our efforts at prevention and control, and have fueled, I think, some of the worst behavior in terms of the kinds of collaboration that would have been necessary to have acted sooner, quicker, and in a much more collaborative fashion. So on this, we propose 2 recommendations. One, that governments, international and regional health authorities have to promote information based on science. And we've seen, and again, Julio, I think, pointed this out very well, that certain political tendencies led to a very lack of science-based, lack of belief in science, and fueled some of the disinformation and misinformation. So we all have a part to play, whether it's government, whether it's health authorities, and media, all have a role to play in countering this. So, and then our second recommendation was to develop the strategies to counter misinformation, disinformation, and conspiracy theories. Again, I think we all have a role to play, but this is where I think looking at behavioral science, communication science, and some of the other areas that we often don't pull on as much, so important as we think about the role that information plays. How do we think about verifying information, setting up systems that allow us to check, debunk rumors and conspiracy, and make sure that we're providing evidence-based information in ways that make it accessible to the range of populations that we're trying to reach. So with that, I will just close and again say how honored I have been to be part of this, to see the commitment that people have to making the region stronger, to really use the tools that we have in place, but use them with greater urgency, as well as some of the innovations that I think that came out throughout our discussions. So I think it is now my turn to turn it over. Who is first on the list of discussants? I'll turn it back over to you, Michael, because you have the lineup. Thank you very much.
Thank you very much, Helene. That was excellent. Thank you, Julio. Really very, very clear presentations, expositions about the main points. Now we'll move to the discussion. We'll 2 commentators, and we'll start with Carlos Felipe.
Thank you very much, Michael. And thank you and congrats to Julio, Helene, and all the members of the task force for this fantastic report. If you're looking for some big criticism of this report, you will not find it in my comments. On the contrary, I will say I find very convincing and I support the bulk of the analysis and the recommendations. And it is wonderful to bring all these perspectives from a broad range of people in this task force. And I want to thank you, Michael, and the Inter-American Dialogue and also Beatriz and Heidi for bringing everyone together around this white paper. It's really an excellent job, and I'm very honored to be here as a discussant along with Ramiro in Colombia. So thanks to this work, we've been able to reflect on the regional response to COVID-19 so far. And I think the lessons that are drawn out are generally the right ones, and the recommendations I think are powerful. And they should help the region move forward to a future that is not a new normal, but as Julio said, a better normal. And I think it's very valuable in that respect. So I think the bottom line for me to start with is this lack of coordination. The lack of effective coordination at all levels, international, within countries, is identified in the report as the key factor behind the inability of the response. And I couldn't agree more. This lack of coordination has gone beyond health issues, but it's also affected a number of other areas of importance for this response, such as the movement of goods across borders, trade, issues of borders and information technology, etc. This lack of coordination has also taken place within countries, with countries struggling in many cases to lead an effective response with their own subnational governments at the local level, at the state level. And I think this is very important to signal. So let me focus my 10 minutes on maybe 4 main comments, one per each one of the axes as were laid out in the report and presented by Julio and by Helene just now. And by the way, just to announce that, of course, the World Bank and I'm sure the other organizations represented in the task force should play a big role in supporting efforts going forward, hopefully in a coordinated manner. So the first axis is about data. So as one of my sons reminds me, look, but data is boring. Information systems are boring. Records are boring. I said, yes, but they can make the difference between life or death. And I think in this case, the lack of investment in reliable information systems, routine information systems, including simple electronic medical records, has been the major impediment to a more effective response to the pandemic. Developing systems that can capture signals, early signals of outbreak, clearly is not a luxury anymore, as we have seen. It is a necessity. And so innovations are needed, through artificial intelligence, machine learning, geospatial technology that can enable countries to make better decisions in an emergency, but also to better understand the performance of the health system and how to improve its efficiency, its results, its coverage. So from this perspective, I would also like to offer the World Bank's assistance. We're ready to work with countries and anybody else on building up more robust and more effective information systems and data. Now, the other point that my son reminds me of is that information today is very valuable. It's gold. Says, look, that's why all these big IT companies, they gather all the information that you can when I'm in the internet, and they hoard it. Well, I'm telling my son again that this is precisely why we're not going forward on this. It turns out that in health, and particularly in these kinds of pandemics, sharing information transparently and on a regular basis is absolutely key to build the trust required to address the risks that cut across the groups of countries and regions. Moving forward, it will be important to discuss what is the core information that should be shared across countries and how to standardize and improve the data quality and how this information can truly be used to put to good use by all the countries, and the level of interdependency between countries and the increasing mobility of the populations make this a very critical investment. Let me move to the second axis. The second axis is about the non-compliance with the international health regulations. And here I'll just highlight the importance of assess, evaluate, prioritize, and then invest in that order. I think, yes, countries have been moving slowly towards these IHR regulations, but the progress has been too slow and uneven. And it's really important to take the next bold step, which is to enable transparent and independent assessments of the core capacities and preparedness of countries, then understand what the gaps are, which are the critical ones, and then prioritize, and then make the investments to move forward to address those gaps and move forward in strengthening the systems. Full compliance with the IHR requires a process, I think, and I would like to emphasize the point of the evaluation. I think we need transparent, independent, and regular reviews of pandemic preparedness and response. This process should not only focus on compliance with standards, but also look at the response during public health outbreaks. The IHR should be applied under a proactive approach based on continuous improvement of the different capacities and not just focus on the capacities with the lowest scores. And an independent, transparent, and regular third-party continuous evaluation system for pandemic preparedness should be set up with the support of PAHO and, of course, the multilateral development banks. And we are working with some countries to identify opportunities for improvement, and we're ready to coordinate for this effort. The third axis is about equitable access. And as Helene pointed out, this, of course, has been the saddest and most unfair parts of what we have witnessed in this pandemic. The inequity in access to the PPEs, to the ICUs, the equipment, and the vaccines that unfortunately has been distributed mainly according to the power of the dollar, of the income of countries, not the needs. We in the World Bank, we've been making huge efforts. We stepped up with some things we've never done before, like procurement support, tapping directly companies that produce ventilators, that produce PPEs and other things. Now the vaccines, the pharmaceuticals themselves, and we made available a lot of money. I think by now 100 countries have signed up to our programs. We offer them finance, and we made, I think, over $12 billion available just for the vaccine piece of financing, but it has not been enough. I think the IDB has been very involved. And COVAX, I'd like to highlight, I think COVAX was a very interesting experience, a first experience in this realm of vaccine financing and distribution to try to ensure that it was fair and that it was more equitable, but it also has not been enough. It is very clear that the COVAX effort has not filled the expectations yet. I think we're trying to improve it as we speak, because it's really the only game in town to ensure that the poorer countries and the middle-income countries have a fair access to vaccines. Many countries, as we speak, are still struggling to secure enough doses to cover their population. And you have seen across Latin America and the Caribbean, social instability, social unrest, because governments have not been able to access enough of these vaccines. So the equitable distribution of vaccines is a huge challenge. There have been many failures in this area. We should all recognize, and we in the World Bank will continue to provide evidence that this is not just a health problem, but it's also an issue of a huge impact on the future economic development of the region, and with a huge impact, especially on the poor and vulnerable populations. I hope countries can continue to work together to make sure that enough financial resources are made available to COVAX. It still needs financing. We're making more financing available as we speak, but there is still a ways to go. And in addition, I think an important point that Helene pointed out, I do want to reinforce it, is this manufacturing capacity. A number of the countries that make vaccines, they've restricted their exports. This is not good. We need to find a way to spread out this manufacturing capacity around the world, and for policies to be more equitable in distributing. I'm very happy to say that we have ongoing discussions with a number of countries in Latin America, particularly advanced in places like Colombia and Chile, offering support to increase manufacturing capacity in close collaboration with our sister organization, the IFC. And finally, the fourth axis, which is about misinformation and all of that. I think Helene was very clear on that. All I will say is that communication effectively and efficiently is absolutely critical, and messages designed to promote infection prevention, the basic ones that I hope all of us connected here know by now, by heart, on masks and social distancing. They've unfortunately been met with counter information across the region, and this has been exacerbated sometimes by governments themselves, different parts of the governments giving confusing and sometimes contradictory messages. So in order to address this country, I think I would like to support the recommendation that countries rely on evidence-based decisions, on science, and that they communicate clearly and in a concise and consistent manner. Countries should also invest in better systems to track and assess information and beliefs among the population, to understand where the sources of misinformation and disinformation are coming from, and then respond accordingly. Good. Let me end by just making a final remark on the next steps for further cooperation. It seems clear to us that countries need to continue to improve their capacities to prepare and to respond to emergencies such as this one, this COVID pandemic. And meeting these challenges requires innovative policy, but also institutional responses that need to be designed in a tough world where on the one hand, countries don't have that many resources. They've spent a lot of resources responding to the pandemic. And on the other side, we're all trying to cope with climate change, which in our region is creating more hurricanes, more droughts, more floods. And so we do need to call for effective and integrated solutions. So promoting coordination and capacity building, I think, is a critical step that we must all rally around. And since the beginning of this outbreak, the silver lining is, I think, we've been working together with PAHO, with the IDB, with the countries very well. But we need to cement this coordination and this cooperation. So a meeting of the Latin American and Caribbean, maybe the regional global health and finance leaders, at least once a year, could be organized to define selected strategy areas for partnership and for investment and collaboration, and to set objectives for the future. Perhaps it could happen around the time of the IMF, World Bank annual meetings or spring meetings. I don't know. But for such a meeting, the Inter-American Task Force could chair and set the agenda. And we at the World Bank would love to be a part of it. We're very happy to host at our premises if needed. Let me end by saying that the 4 principles outlined in the paper, which are solidarity, transparency, trust, and sustainability, are, I think, a very clear framework for cooperation. And the current pandemic has proved that when one country is vulnerable, all are, and any barrier to effective cooperation will lead to worsening of the impacts and human suffering. So together, and with the support of partners such as the multilaterals and PAHO, countries in the Western Hemisphere should aim to put in place the necessary mechanisms to tackle future crises and continue progress towards universal health coverage and improving the well-being of the population. Thank you. I turn it over to Michael.
Thank you. Thank you, Carlos Felipe. That was really excellent. And thank you also for informing us about the important work that the World Bank is doing in this area. Really very impressive, and congratulations for all that you're doing. So thank you for that. Let me turn it over now to Ramiro, joins us from Cali, Colombia, to get a different perspective on the white paper. Ramiro.
Thank you, Michael. Thank you. Thanks for the invitation to the Inter-American Dialogue, and I'm truly delighted to be here and share some remarks and comments on the document, on the white paper. I would start by saying that I very much like the way it was framed along those pillars or axes. These axes they clearly identify the dimensions along which the international health policy should be understood currently as the continent navigates the pandemic. I think every relevant policy issue can be located in these axes, so nothing is missing. And it's a very constructive way of framing the discussion. As Carlos Felipe did, I will touch on selected topics and recommendations in these axes without being exhaustive, of course. And starting with the sharing of data, which is, of course, related to technical capacity. It is clearly urgent to strengthen surveillance at every level. That leads one to think what kinds of institutions are needed for doing this. And we have some countries with fairly strong, technically strong national institutes for health, probably not in every country, but in a fair amount of them. So the first thing that would be perhaps needed would be that they work in collaboration in a true network. And this, of course, connects with the partnerships with the CDC that Helene also mentioned. But that would be like at the international level. But within countries, surveillance has to be strengthened down to every corner of every country and down to every municipality. So there's, and capacities and surveillance capacities within countries are not evenly distributed. To the contrary, they are very unevenly distributed. So that highlights the need of working within the countries and with a particular emphasis in training. The report touches on human capital. I think that deserves to be highlighted. It is really very important, along with many other things that have already been mentioned in order to strengthen this surveillance capacity. Then on security, on health security and international health regulation, there's a lot to be said about it. I will go back to it towards the end of my comments. But the report lays out the debate about whether this is a matter of political will, or is this a matter where more international regulation is needed. I tend to think that it's more a matter of political will. But what I would like to say here is that one of the things that are needed for having good functional international health regulations are highly competent and highly competent technical institutes within countries. I mean, having competent and functional technical institutes in any domain, not only in the health domain, but in any domain, it makes it harder for governments to tweak or to hide the data. So having that technical capacity and prestige is very important. It's a matter of institution building, perhaps. These institutions also have they should be sort of independent, very much like central banks are from central governments, because they have to tell bad news sometimes and provide guidance that might not be exactly popular in certain contexts. So they should be protected, and so I'm just inviting to view them in a perspective of institutional building. And ultimately, competence is the basis of credibility. Credibility comes from people or institutions that have deserved their credibility on the basis of being competent. So It's part of what is needed, again, in addition to all else that has been mentioned in regard to health security and international health regulations, about which I will also come back. Then on manufacturing capacity, this is very important. The global social contract that governs trade of medical goods has been broken. Trade implies specialization. Some countries decide to renounce or to abandon their capacity to produce certain goods in the expectation of being able to buy them from other countries in case of need. It's of course a long-term commitment in good times and bad, in sickness and health, very much like in marriage. But the countries that have specialized in the past in manufacturing critical medical goods have proven to be unreliable partners. And that's very sad, and that has happened within the hemisphere. Hoarding and export bans have been labeled a moral failure, specifically in regard to vaccines by WHO Director General. It is true. It is a failure that will have long-term consequences. I mean, for middle-income countries in the region, there is no alternative to catching up in terms of scientific capacity and technology. That will take a good amount of investment, a good amount of patience and perseverance, because Carlos Felipe was mentioning the support that the World Bank is offering for constructing those capacities, but I'm afraid it will take a lot of time and perseverance, but there's no alternative to it given what has happened. But it's sort of something has been broken there in terms of trust internationally and international relations and on the social contract that governs trade of such important goods. Then some going forward to another pillar or axis, misinformation and disinformation, so important. The report calls it an infodemic, and because disinformation kills. Someone was saying shortly one of these days, and there's a lot to do there. Indeed, we are used colloquially to saying that certain story goes viral, and it's the word is very meaningful in our context, because we don't have nearly as good as an understanding of how information spreads as we have of how a virus spreads. It is ultimately people who share the information. So if we are to pin down disinformation and misinformation, we have to break it up, the problem in pieces. I mean, locate where the information was generated, where the origin of it, but more importantly, the mechanism by which it has spread. Recently, there's a book by Robert Shiller, this Yale Nobel laureate economist, called Narrative Economics, and he applies epidemiologic models to analyzing how stories spread, and the factors that determine whether a story will spread or not sadly don't have anything to do with whether it's true or not. So we have to invest a lot in the science of information spreading. We live in an age in which there's no longer any control or top-down control of information, but by a handful of big media outlets or by governments, at least in open and democratic societies. We live in a world in which again, it is people who spread the news, and it is people who spread the virus. So we probably need a better understanding of those dynamics, of the science of information spreading, of the science of of information flows in networks, in order to come up with better policy prescriptions. So far, we know that the solution will involve some education, certainly, some regulation, but regulation is tricky, sometimes controversial. So I would just invite to invest in the research, in the understanding of how information flows these days in order to come up with smarter responses to infodemics, because as Michael was saying in his opening remarks, this is relevant not only for the current pandemic, but also for the future. And then last but not least, political leadership and governance. Compliance with IHR, cooperation, coordination, commitment to multilateral frameworks, they all have something in common. They are all matters of political will. And there is no such thing as mandatory political will. Reluctant compliance won't be good enough in the long run. We need true political will, and that cannot be forced. So the question comes of how do you go about generating authentic political will and long-run commitment to multilateralism? That's a big question, but then something that we could say here is that I think it was Walter Reed, and Julio will correct me if I'm wrong, who said many years ago that in order to control malaria, you have to learn to think like a mosquito. I think he said it while building the Panama Canal. So we might say that in order to promote political will, we have to learn to think like a national leader. And national leaders do not operate in isolation. They are held accountable by Congresses, by judiciary. They have to deal with political parties. They have to deal with public opinion. So if all these actors are not committed to multilateralism and international cooperation, probably we won't get very far. So this is, I say this because the report very conveniently contains a matrix where the recommendations are addressed to certain actors, clearly identified. There's a column for governments, there's a column for multilateral organizations, there's a column for international financial institutions, civil society, and then what I would say is that when looking at the column for governments, probably we should understand them more broadly as recommendations issued or delivered or addressed to the political system, more broadly understood and not narrowly directed to governments who by themselves are constrained by the context in which they operate. So this is probably a good reason to disseminate the report more among the whole set of actors of the political system in order for it to be more effective in fulfilling its goals. So that would be my final comment. And again, thanking you for the invitation and congratulations, of course, to the task force, to the chairs that are present. And so I turn it now over to Michael.
Sorry about that. Excuse me. I should by this time I should be able to do that much more easily. Thank you, Ramiro, for those excellent, very, very helpful, illuminating comments. And let me just remind our audience that if they want to join the conversation, I invite you to submit questions using the Q&A feature in Zoom, or you could email us at meetings@thedialogue.org. We have a number of questions, but let me maybe start with this one, and it's we do have a question from a distinguished member of our task force that's directed to Helene Gayle from Donna Shalala, but let me frame that, and let me pose that question to both Helene and Julio, but also frame it more widely, since we have another question that relates to it. And Congresswoman Shalala's question is, didn't we see misinformation during the AIDS epidemic? I remember Mbeki was consumed by conspiracy theories. So maybe this issue of the question of putting this misinformation, false information in perspective, has it always been there? Is it that much worse? And then, there is a question on what should be done. That a questioner asked very directly, what do we recommend? I mean, is there censorship? How do you regulate information? Obviously, it's a very delicate situation and you have to strike the right balance. But, in light of where this trend seems to be going of misinformation, which I think all of the speakers have identified, what is the best approach? And also to maybe put this in perspective, as Donna Shalala asked, let me turn it to Helene, and then maybe Julio can respond to that.
Yeah, thanks, and thanks for that question. And I think Donna Shalala was my secretary at the time that we were both working on HIV and some of the misinformation then. And it is true that President Mbeki, really did fuel some of the misinformation around HIV and AIDS in South Africa, and it went beyond that. And I remember back at that time, a lot of what seemed to fuel some of his misinformation was the internet. And I say that, not to say that the internet is a bad thing. We all know that the internet has in many ways brought good information to our fingertips in ways that we didn't have before. But I think we've seen a proliferation. If we think about that as a couple of decades ago, the vehicles for misinformation are even greater. And so, I think it has accelerated. Social media, all of the different ways that people are using information, and particularly selectively using information to reinforce positions. And, so to the point of, is this worse? I think, in fact, it has escalated. I think because of the number of vehicles and the ways in which people can get information, and, the ways that people have become more clever about disguising misinformation as facts. So I think, as I think all of us have said in so many ways, we have a real problem on our hands. I also think it harkens back to some of the things that Julio was saying around how, particular trend of leadership tends to also cluster with a non-fact-based, non-science-based, and, more populist way of ruling, which does often go hand in hand with this misinformation, disinformation. I think I will leave it to others to talk about regulation and what's the right balance there. I think it's a very complex issue, and there are people, who do this for a living and study this and still think that this is incredibly hard. But I think for us who are thinking about how we get good information out there, I think we have not been as creative and innovative about how we get information to people. And I think, health people are good at talking to health people. And we've got to think better about how do we get much more cross-disciplinary? How do we bring in communication science? How do we think, bring in behavioral science? How do we build a database around informing people so that our messages are as captivating as the counter messages? We've got to do a better job on our side to get information to people in ways that they hear it, ways that make sense, ways that touch them, so that we're, countering the misinformation in more effective ways. And I think Ramiro mentioned, even how we have our databases, like our surveillance information. If we're not giving people up-to-date, accurate information, they'll fill it in with whatever else they can. So I think, all of the things we've said about building our information systems are important, but I think we also have to think about who are the right messages, what are the right messages, and who are the right messengers to be able to do a better job of getting good information out there.
Great, thank you. Julio?
Well, Donna was Helene's secretary, and she is my predecessor at the University of Miami. So we're delighted to have her on the task force. It's a very important comment. this is actually not new. She's absolutely right. And it goes way beyond AIDS. Pandemics are not new. We have the first recorded pandemics in Athens, the plague that actually killed Pericles, and it goes to the Black Death and the contact of Europeans with native populations in the Americas, in Eurasia, etc. In every step of the way, there's been misinformation, there's been scapegoating. There's the famous blood libels surrounding the Black Death and the terrible pogroms of Jewish populations in Europe during the Black Death. This is a stain of humans. The idea that you blame others for your own misfortunes. What is different is that because we're more interconnected, we have this double-edged sword. On the one hand, pandemics have become way more frequent. But on the other hand, we not just have a planet with many, many more people, but we also have people that are much better equipped to understand the origins of pandemics and do not no longer attribute it to whatever other explanations happened in the past. And therefore, I think it makes the misinformation even more dramatic. One thing is misinformation that stems out of pure sheer ignorance. But at a time when we understand the microbial origin of viruses, when we understand the basic biology by which vaccines operate or face coverings prevent transmission, to have the level of induced, one thing is sort of natural state ignorance because science has not progressed as much. Another thing, I think, is induced, sometimes with malicious intent, disinformation. And of course, the big difference nowadays is that we, part of our interconnection has a bright side. We have achieved levels of scientific cooperation on an unprecedented scale that have given us vaccines in a record time, but it has a not so bright side in the fact that any piece of misinformation, like Ramiro was saying, goes viral instantly and irrespective of its truth content. And that's where I do agree very much with Ramiro's point that we need to understand the communication of information. We're good at generating scientifically validated data, but how that gets communicated, not just to common people, but also to policymakers, and how it informs policymaking, I think is a science that we still don't understand fully. And I think there's a very clear agenda there. Because in the end, the problem I think we have had in this pandemic is, I think Carlos Felipe said it, if the data at the origin is not communicated in a timely and credible way, once you erode the credibility of the political leadership of a country, you create that vacuum. And this is exactly what happened here, particularly with populist leaders who come from that background of mistrust of science and active hostility towards experts. We started seeing the minimization of the pandemic, the constant promises that this was going to go away, that this was like a small flu. And you see it on our continent. It goes from former President Trump here to López Obrador in Mexico to Bolsonaro. It goes all the geography of our hemisphere, almost like a common script of minimization. And that eroded the credibility right on and created this vacuum that then is filled by misinformation that has been so harmful. And I do think it does go back to a question of leadership. The good leaders, those that have performed well, would carry out communication that had several characteristics. It was clear. They all start with a C: clear, concise, and credible. And the big failures of leadership were leaders who failed on the three counts. So I think that's a huge lesson. The need to invest more in understanding that parallel infodemic the need, which starts with bad data systems, with data systems that create the vacuum. But then even when the data is correct, even when the science in understanding the nature of the virus is sound, how do we make sure that that gets communicated in a credible way and that there's an active element of timely intervention on the communication front? In the end, some of the biggest victories of public health were achieved by being able to translate scientifically derived knowledge into common behaviors, like people washing their hands or people widely accepting some elements of personal hygiene. That translation into behaviors, wearing a condom in the case of AIDS, that was alluded to, taking a vaccine, using a cover, a face cover, all of that translation is, I think, in itself, it is in itself a matter of research, and something that when we look at the failures of leadership, this is one where we need to do much better than the next time.
Thank you. I have a question that I think is very much connected to a broader debate that's happening in Latin America today, but it would be interesting to get perspectives of either Helene and Julio or Ramiro and Carlos Felipe, which is somebody asks, as a consequence of the pandemic, do you think governments will play a bigger role vis-a-vis the private sector in the health sector? Is there evidence that public or private health systems work better to control the virus? Julio, you want to start with that?
I mean, clearly there's a fundamental role here. We're talking about some public goods, and it is very hard to rely on pure private mechanisms if by that we understand an allocation of resources following simple market mechanisms. That happens whether it's public health or healthcare delivered to individuals. This is well known. It is, and so I think it is a false dilemma. I really think it's a false dilemma. In the end, good functioning health systems have a strong element of stewardship, which is the quintessential public function by governments that are then held to account. And that includes providing this basic public goods like good data, and includes setting clear rules of the game and providing leadership and strategic direction in regular times, and especially during a pandemic. But that public function needs to be carried out by effectors, of which you have a mix of public and private actors. There is no country in the world has a purely public or a purely private health system. There's always a blend, a mix. And the key to me is when you allocate the right functions, when you distribute the functions to different actors. And functions like stewardship, financing in health has to be mostly public. This is not an ideological statement. This is backed by substantial bodies of evidence. But when it comes to the delivery of services, the best structures are those that are pluralistic, that combine both private, for-profit, and not-for-profit entities and public entities. So long as you have clear and stewardship and public financing, I think you can then have a pluralistic system. The best performing systems are those that get the question of the public-private mix right. The worst performing systems are those that don't get those functions well, and it really is secondary if it is owned by the government or owned by a private entity. It's getting the mix of functions right, and that explains a good performance.
Great, Helene?
I don't have a lot to add to that. I think it's part of a lot of what why we kind of developed the matrix that we developed, which was, clear that there are different actors that have different roles. And I think, Julio expressed it very well. We know the private sector has a huge role to play when it comes to things like production and manufacturing, product innovation, et cetera. But clearly, there are those kind of normative roles that government can play, public good roles that government needs to play. I would just add to that, though, I think also thinking about the role that nonprofit actors also play in civil society, because I think, we're seeing that very much, in a lot of places where it's been so important to have the partnership with community-based organizations and others when we think about things like vaccine hesitancy and how we actually change behaviors and other things. So I just think, that's why that Julio said so well, it's really making sure we apportion the right things to the right actors and have the right kind of coordination to make it work.
Great, thank you. I think, Carlos Felipe, you would like to say something, I think. And there's also a question directly at you, taking advantage of you having the floor. Just somebody asks about what social policies would you give priority to and would have the greatest impact? Mute. I think we're not.
Yeah, it looks like you're coming on and off, but it's not clear why we can't hear you. I think we all figured that this many months into this, there's no way we don't know every trick that there is, but.
Okay.
Here.
There you go. No?
I think if you go to the little microphone and you select the microphone, that may be what you need.
Okay. Why don't we go? Let me go to another question, which is related to this, which is, why, which is a question asked by Javier Guzman, why hasn't the region been more successful at creating, repurposing, manufacturing capacity for COVID vaccines, even though it has clear assets to get this work done? Is this due to a failure of multiple dysfunctional regional platforms, inaction from the banks? What's the explanation?
Well, I think we also need to point out some positive examples. Okay. There is a very interesting example that happened with the AstraZeneca vaccine, where a private pharmaceutical, Latin America, of all developing regions, is the one that has the largest national capacity or national pharmaceutical industry. And several of the countries in Latin America actually have a strong national base in terms of pharmaceutical production. And this is the case where early on at the AstraZeneca vaccine, there was a deal that included philanthropy from the Carlos Slim Foundation, two firms, one in Argentina, one in Mexico, agreeing to entering into parts of the manufacturing process for the AstraZeneca vaccine. And that has increased the availability of that particular vaccine in the region. I think we need more examples of that. But to me, I think at the end of the pandemic, we should actually start developing a few case studies of actually things that did work well, because, we do, I think, understandably, tend to be critical, but we shouldn't forget that there have been some bright spots. And I do want to signal that this one, it was an interesting mix of public, private, and philanthropic intervention to make sure that more vaccines were available. And now, having said that, there's no question that for the future, we need a much more regionalized capacity for vaccine production and tests. One of the questions actually said we haven't mentioned testing enough, and I think it's a very, very pertinent comment. Testing was the big failure at the beginning. and we lost precious time. And with a virus that expands as rapidly, as I said in my comments, even a week or 2 or 3 of delays can translate into thousands or millions of cases. So we need, one of the lessons is we need to regionalize capacity. And Latin America and the Caribbean, of all developing regions, should be at the forefront of that capacity building. There's an enormous platform from which to build up. We're not starting from zero, and I think we can do much better to be better prepared for future emergencies.
Thank you. Yes.
Can you hear me now, Michael?
Yes. Yes. Yeah, you're back. Now I can hear you. You want to weigh in on that question?
So no, just very briefly, I just wanted to add to the answer that Julio and Helene gave on the private sector bid.
Right.
That that the something that I sense, but I don't have evidence, but we will have evidence soon, is that the countries where the deployment of the vaccines has encompassed an all of society approach, meaning public, private, community-based organizations, everybody involved on both the campaign, the outreach, and the actual vaccination itself, is probably where it's worked the best. I think we're seeing a natural experiment. Some countries have been very conservative and only apply vaccines in health centers. Others are being, I just came back from Ecuador. They're distributing vaccines to any private sector company that meets some basic requirements. They're vaccinating their employees and their families. They're using the military. They're using all kinds of different innovative ways. And the speed of vaccination there, I was following the last 3 weeks. They're setting the global record for as we speak for the number of people per 100 vaccinated. So and other countries gone very slow because not everybody's involved. So I just wanted to call that out because I think it's important that we realize that everybody needs to be involved. It's not just the government. It's not just some. So and then there was a tougher question that somebody asked on.
Somebody asked about your right priorities and social policies. What if with limited resources, what would you give priority to?
Listen, the only thing I would say very quickly on that is simply that generally I've been happy with the way that countries have deployed their social transfer, their cash transfer programs that they built over the last 20 years to get to the poor and the vulnerable very quickly. I think most countries have done this, even though they have limited resources, but they have managed to get to the most vulnerable populations for the most part, with limitations, but that has been generally very positive. It's really helped the unemployed and the people who are suffering the most. Going forward, I think the social policy that I'd like to see a lot more attention to is I really feel that over the last year and a half, children have lost a lot of schooling. And this will have grave repercussions for the future if nothing is done for them to catch up and bring their learning abilities back up to where they should be. This is going to have a lifelong impact. So I would focus on that going forward.
Excellent, profound issue. Ramiro, let me turn to you if you have any thoughts on any of what's been discussed, and then I'll wrap it up. So we're reaching the end of our time, but I want to give you an opportunity.
Yeah, no, I was just highlight what Carlos Felipe said. I'm glad that he pointed to education. I think it's one of the long-term liabilities that we have now. And it's really, really urgent. So I would just highlight that and wouldn't have anything else to add, Michael. Thank you.
Great. Thank you very much. Well, we reached the end of our time. This has been a fantastic discussion, and I really am very grateful to Ramiro and to Carlos Felipe for their very valuable, insightful comments, and of course to Julio and to Helene for their leadership, extraordinary leadership of this task force, and to all the task force members who have joined. If you permit me just a final reflection, I commented on a very good paper produced by the Carnegie Endowment last week on reimagining regional governance. And one of the conclusions or recommendation is that, we live at a moment, unfortunately, when the politics are not very encouraging in many countries in the region. And so political will is not there, and the conditions for some sort of transformative, ambitious regional integration project are probably not realistic today. And one of the recommendations and lines that I found very useful in that paper, and that I think is kind of reinforced by the white paper and this discussion today, is to focus on the technical and to focus on incremental, practical steps that can be taken in a very positive direction that make a real difference. So I think we should all be very honest that we probably would like there to be more political will than there is today, but there isn't, and maybe that will come, and hopefully it will. But in the meantime, there's urgent work to do, and there are a lot of very practical, constructive, realistic things that can and should be done. And in my judgment, this white paper really identifies those areas very, very well, and points in a very positive direction. So hopefully it can serve as a roadmap for those who are making decisions and who care about the current pandemic and its continuing impact, but also future health emergencies that will inevitably have to confront all of us. And so I just want to commend again members of the task force, Julio and Helene, Felipe, and Ramiro, for really shedding so much light on these issues today. And the dialogue will continue to try to build on this white paper to focus on how to strengthen healthcare policy and strengthen coordination and cooperation in the Americas, because it will benefit all of us. So thank you all very, very much. Please stay well. And again, my gratitude and appreciation to everybody for their tremendous contribution.